Hello, it's Dr. Rhonda Johnson, and today is Monday, August 30th, 2021. What do these words mean to you? I can't breathe. I can't breathe. I can't breathe. What images do these words invoke when you hear them? Some people might think of George Floyd. Some people might think of Eric Garner. But if you're a healthcare professional, or if you're working in the emergency rooms, or if you're a first responder, these are the words that people are saying who are sick from COVID. And they're saying them over and over and over and over again when they need emergency room care. Now, what they're not saying when they seek emergency care, they're not saying, I don't want experimental treatment. What's in that experimental treatment? My immune system is taking care of me. They're not saying my body, my right. They're not saying I don't trust the government and I don't want that treatment. They're saying I can't breathe. And why are they saying they can't breathe? Because COVID has infected their lungs. The virus has replicated billions of times and caused a lot of damage to the lung tissue, and there's pus and there's fluid. And guess what? The lungs can no longer do what they do normally, which is exchange air that causes you to be able to breathe. Now, I realize that not everyone with the Delta variant is going to end up in the emergency room saying, I can't breathe. But let's be real here. Thousands of people in every state across the United States are. Emergency rooms are full. Hospital beds are full. ICU beds in many states in the part of the United States where vaccination rates are low are almost full. For a lot of us, the Delta variant is hitting close to home. Our family members, our friends, our neighbors, people we know. And guess what? Doctors, real doctors taking care of patients are saying that the Delta variant is causing much more severe illness. People are getting sicker faster. Now, the American Academy of Pediatrics say that children and teens represent almost 25% of all new COVID cases nationwide, and 16 to 17-year-olds are among the hardest hit. And pediatric hospitals, children's hospitals, are struggling to take care of the record number of infants, children, and teens that are being hospitalized. This is a tragedy. Now, the CDC on August 5th released a report looking at who was hospitalized. This is public information. Don't take my word for it. You can find it yourself. And indigenous populations, Black and Latinx, children between 0 and 17, and young people between the ages of 18 and 49, they are currently, right now, being hospitalized at rates that are 3 to 4 times higher than whites. Looking at who is in the hospital, according to the CDC, 44% are Black, 36% are Latinx, and 16% are white. And again, hospital officials are saying that 99% of all people hospitalized in their institutions are unvaccinated. Now, another report from the CDC that looked at hospitalized patients are saying that 37% of these people are developing acute kidney injury. And among those with acute kidney injury, 35% of them are dying. And acute kidney injury is more likely in Black patients than white patients for unknown reasons. And the CDC says this rare complication from COVID in children, this MIS-C, multi-system inflammatory syndrome, that rare but severe life-threatening condition that occurs 2 to 4 weeks after COVID starts in children and adolescents, The CDC says that more than 70% of the reported cases have occurred in children who are Hispanic or Latino or Black. Folks, this is a crisis. The Delta variant is so contagious. I heard an expert say yesterday that nearly everybody's going to be infected sooner or later, both the vaccinated and unvaccinated. But the difference is that the vaccinated group, although they can transmit the infection to the unvaccinated, they're not going to get as critically ill if they have a working immune system. So, folks, if you want to remain unvaccinated, you're choosing most likely to get the Delta variant. So you got to know the signs and symptoms of infection. You have to know when people are getting worse. Remember about the monoclonal antibody treatments that can save your lives early in COVID infection. And please plan. Have things ready. Have a thermometer. Have fluids. Have a pulse oximeter. Have fever reducers such as Tylenol or ibuprofen. Have a humidifier. And by all means, have a doctor nearby, a relationship with a doctor, or make your plan of when you need to go to the emergency room. And have some simple foods, soup, crackers, baby formula. Plan where the sick can be isolated from the family if necessary. Now, I'm going to say something that I haven't said before. Recall the definition of insanity. The dictionary says it's a state of being seriously mentally ill or just plain old madness. But Albert Einstein said the definition of insanity is doing the same thing over and over and expecting different results. For Black and brown people, I know there are many reasons why you won't take the vaccine. Some of it's distrust of the government, but this is literally killing us during this pandemic. These are the facts, and the reality is that a lot of people are getting seriously ill, they're suffering, and the Delta variant is the cause. And these sickness and death are largely preventable by the COVID vaccine. The vaccine is not a force shield. You still have to wear a mask, wash your hands, etc. Now, we know how this story ended in year one of the pandemic, and we can see how this story is going to end with the Delta variant unless people make the choice to get vaccinated. And then you won't have to go to the emergency room saying, I can't breathe, I can't breathe, I can't breathe. This is Dr. Rhonda Johnson. My views are my own. My only intent is to help save lives. Please feel free to share this message. You can comment if you want. I won't mind responding to your comments. Have a blessed day.